Good night, good evening, good morning, whatever time zone you're in. You're tuning in to the Chit show with your co-host Uno and
Greetings, everybody. Your other co-host, Aisha, also known as Jade.
She's back, y'all.
I'm back. And let me just take a quick thanks out to the Creator and Divine Intervention, Universe above, because I just got back to work today. I was out all last week on bed rest because pretty much I had symptoms of having a heart attack and didn't even really know it like that. I was wondering why I was feeling the way that I was feeling, and so it took me to go to the doctors, and she just pretty much let me know overall that I gotta do better. So I was out the whole week, had a bad and on top of that I wound up having an abscess, go figure. And so I had a bad reaction to the medicine, which of course blew my face up more. And you know what? No job, no family. I know this is going to sound kind of cruel, but nothing and nobody is worth your health and well-being. We must take care of ourselves, our temples, from head to toe. Me and Uno, we always talk about taking care of yourself, self-care, how important it is, self-respect, self-love, making sure that you take care of yourself however that looks for you. The body has a way, and the higher powers that be has a way of shutting it down when you don't listen. And that's pretty much what it did. It shut me down for a week. And I have to be honest, it really concerned me, and it scared me too a little bit. So I'm just grateful. I'm not 100%. I'm about, I say 55, maybe 60%. And every day I'm just praying above to get stronger and better, and have to make some healthy, conscious decisions on reprioritizing things, whether that's with family, whether that's with whatever the relationship that I have, working relationship, associates, things of that nature. So I'm just grateful to be back, you guys.
Yes, I am grateful for you to be back. At least doing well. I know you're not 100%. I'm just glad you're back on the show, ready to do the things we always do every Monday.
That's right.
Talk about some great topics and just really be ourselves and have fun.
Absolutely. So
I will cover what we are covering, actually, March Awareness Month. So the awarenesses that we're covering, we have Save Your Vision Month. We have National MS Education. We have Workplace Eye Wellness, National Kidney Month, and Brain Injury Month. But the first one we will start with is National MS Education. So I will give a brief summary on what the purpose of the awareness is. I have two articles, but between both of those, I'm only going to read certain parts to just kind of highlight what the purpose of National MS Education. So with that being said, there's this article that's coming from theresourcefulmama.com. So they basically discuss MS and, kind of briefly, just a little bit, what it is and just what the purpose is of bringing awareness to the disease or the ailment. So, March is National MS Education and Awareness Month. MS is a chronic neurological disorder affecting the central nervous system, which is the brain and spinal cord. More than 2.3 million people worldwide are diagnosed with MS. Most individuals are diagnosed between the ages of 20 and 50, with 2/3 being female. Common symptoms of MS include fatigue, weakness, spasticity, spasticity, which is spasticity, balance problems, bladder and bowel problems, numbness, vision loss, tremors, and depression. The path and symptoms of MS varies greatly from one individual to another. The National Multiple Sclerosis Society has some great general information and new diagnosed videos on MS. So on this website, you can actually check it out. They have it highlighted where I'm thinking it goes directly to the video. So if you are interested in finding out more information and curious to know more about multiple sclerosis, please check out this website. Towards the bottom of the page, there are 2 MS one-on-one videos that, that's on here. And they're actually downloadable. So, if you don't want to just watch it, but you want to download it and keep it for record, that's fine. Please come to the website. So, that was brief. And this last one I want to read was from synergyhomecare.com.
Can I stop you real quick before you do?
Go ahead.
So we have Bree, who I invited for the show tonight. She said make public so she can share.
From your page or my page?
I guess from my page. I don't know how to share this from my page. I'm not sure. Or she says post to her wall.
She said, go down.
Yes, that's what we do. Mm-hmm.
Yes, we do. It's natural. We being natural. We're not trying to. You go right there and make it public. Oh, well, get out of that the comments and just go in there and make it public. Should be able to. I think you press edit. That's what it is. The 3 dots and then
yeah.
Edit privacy. Now public.
Gotcha. Love it.
All right.
We just had to do that minor thing, so now this is made public, people.
So now people can actually see it and share it and view it, whatever you need to do. So the website that I'm reading from is synergyhomecare.com. All right. So March is, of course, National MS Awareness. The Multiple Sclerosis Foundation was the organization behind the first campaign held in Florida back in 2003. The foundation has worked to expand the campaign nationwide since then. Creating awareness amongst the broader public is the central mission of groups like MSF. Other organizations involved in focusing attention on multiple sclerosis include the National Multiple Sclerosis Society and the Multiple Sclerosis Association of America. The 3 organizations provide information for those affected by MS, their families, and others with an interest in helping others. Participating in sponsored events or volunteering to help are 2 ways to become active in supporting the cause. So, on their site here, for people that are interested in finding out about volunteering, you can come here and follow the directions that they have on this website to get involved. And also, they have local events. There's a link that you can go to that's on the top of their page. You can find out more information. I'm sure they're still active, not just 2003, but I'm sure they're active now. So I'm sure you can find something now on how to get involved with MS awareness. And it provides details. They have a list of walking, running, and cycling events across the state, for those couple of months. And if you want to participate in something yourself, like a local event, or invite family and friends to put together something, y'all come as a team to donate for a worthy cause. So I definitely want you to check it out. This website, I advise you to. I'm sure it has some wealthy information. It's definitely important. So that's what I wanted to read. I told you it was brief, so I just wanted to give you a little highlight on what MS is and what's the purpose of bringing awareness to MS.
Okay. Interesting. I love when we do these. I love the shows in general. I really do. I love when we do the different types of awarenesses, because it definitely enlightens me on things, because of course I don't know everything, but rather it's just a little bit that we speak on, or a whole lot. It just educates me more. And again, I like to thank Bree, because we have to support each other. And if you can't hear the show, at least please let us make me aware, especially if I invite you. Please definitely make us aware. Make us aware if you can't hear it.
We shoot you a link. It's not serious.
So that we can make it public if it's not made public. So thank you so much, Bree.
Appreciate you, Bree. Thank you
for giving me the heads up with that. So hopefully everybody can hear this.
Mm-hmm.
Okay.
Right.
So I want to, again, this is coming from the Multiple Sclerosis Association of America. The website is mymsaa.org. Again, it's from MYMSAA. So we know that Multiple Sclerosis Awareness Month, this organization recognizes it. March is Multiple Sclerosis Awareness Month, and MSAA is proud to support the national campaign with the launch of our new video, Changing Lives Monday to Sunday. Please check out our video and learn more about our inspirational clients and how MSAA helps the MS community today and every day. So they do have a current YouTube video on here. At your leisure, you can definitely check it out when we post these articles up. It says MSAA developed this brief but powerful awareness video to showcase the many ways we help serve the MS community each and every day from Monday to Sunday. Featuring 3 of our clients with MS whose lives were positively impacted by MSAA's free programs and services, the video also seeks to inspire support from the general public to help fulfill our mission of improving lives today. As part of this March campaign, we invite you to learn more about multiple sclerosis as well as MSAA's programs and resources, along with helping us to reach much needed awareness and support for everyone affected by MS. Also, they do have a link if you would like to make a donation today. Your support allows us to continue to help more people in more places with our vital programs. Then below they have different ways where you can help spread the word. You can share the video using the hashtag #ChangeALifeMSAA. And so they have other awareness month links in regards to MS, which is MS Awareness Month badge. They have a press release. They had a art showcase in 2017 from different artists that live with MS, including the latest artist of the month. They have a MS Conversations blog. They have a My MSSA community where you can join their growing online community platform and share your own story about MS during the month of March. They also have learned more about stories behind the MSAA clients featuring in the Changing Lives Monday to Sunday video. And of course, they're on Twitter, Facebook, they have a Google Plus, but it says, like Twitter and Facebook, you can certainly share. They have toll-free number if you want to reach out to them, if you would like to do more. Again, if you want to donate, if in your local area, if you would like to probably volunteer with something, assist them with putting, events together when they have those. So that was just a little tad bit about that. At the bottom of the link, they have more outlets, more social medias. I'll say that, more social medias that you can follow MSAA on for further assistance or information. If you have a loved one, or even if you know someone that's living with MS and you just want to give them some tools and some resources that they can use. It's definitely on here. So that's just a little bit of what I wanted to read from that, I do have another article, and this one has to do with treatment. It's coming from Dr. Axe, which is DRAXE.com. Dr. Axe Food Medicine. And it reads 6 multiple sclerosis natural treatments to manage symptoms. So multiple sclerosis, or MS, is an autoimmune disease that affects the central nervous system. I might be rereading what Una already said, but that's okay. MS affects 2.5 million people worldwide and around 400,000 people in the United States. What are the symptoms of MS and how is it diagnosed? MS symptoms affect each person differently. They can include weakness, numbness, cognitive changes, and blurred vision. Currently, there is no single test that is used for diagnosing multiple sclerosis. So multiple tests will often need to be performed. Doctors will usually diagnose MS based on a patient's symptoms, a physical examination, and results from magnetic resonance imaging tests, MRI. What age does MS start? MS can develop at any age and affects women more often than men. The disorder is most commonly diagnosed between ages 20 and 40, but can be seen in both younger and older people. Because it's not entirely known what causes MS, there is no cure for the condition. The good news is that there are multiple sclerosis natural treatments that often can cause a great empowerment in symptoms, and when combined with other approaches, might even be able to help reverse the condition. What is multiple sclerosis? Well, MS is an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. MS refers to many multiple areas of tissue scarring, sclerosis, and damage. The main type of tissue that is damaged by MS is called myelin, the tissue that wraps around nerves and helps nerve fibers send chemical signals throughout the body. When myelin is damaged, it's called demyelination. Some of the earliest signs and symptoms of MS include changes in sense of touch, loss of strength in one arm or leg, tingling, burning, and itching. When myelin is damaged, nerve signals reaching the eyes, brain, and spinal cord slow down or stop. As MS worsens with time, the brain can sometimes shrink in size as more myelin and axons are destroyed, leading to decreased cognitive functioning and many other symptoms related to nervous system dysfunctions. Can you be born with MS? Most people who develop MS do so as young adults. It's not exactly known what causes all cases of MS, but experts believe that one common cause might be exposure to viruses early in life. Example of 2 viruses that might trigger MS include herpesvirus and retrovirus. It's possible to start developing symptoms of MS early in life, but not receive a diagnosis until years later when the condition has progressed. If you have something on the signs and symptoms, I'll let you read that. Yeah, I want to just kind of get to where they was talking about where they had like 6. It's probably at the bottom.
Probably all the way at the bottom.
So quickly, other risk factors for MS include being between the ages of 20 and 40, being a woman, smoking cigarettes, childhood obesity, vitamin D deficiency during the first 15 years of life. The childhood obesity, they say some research shows that those with a high body mass index, which is BMI, before age 20 may be twice as likely to develop MS as those within a normal weight range. You probably have some other MS symptoms, which include, I'll let that go. I'll get down to...
Seems like there's many of them.
Right.
It's a lot.
You might be repeating them, but I'll just let you read that. I'll let you read
No.
Okay. Mm-mm. So some of the most common causes of a flare-up in MS symptoms include having a fever, the flu, a virus or another illness that stresses the immune system, lack of sleep and increased stress, overexertion and dehydration, spending times in a very hot temperatures or situations such as being in a sauna, experiencing heat exhaustion, or even taking very hot baths, hormonal fluctuations. Mm-hmm. Okay, yeah. So that's just a few of them. So the 6 natural treatments to help manage MS would be 1. Nutrient dense diet high in healthy fats. Dietary factors and lifestyle may exacerbate or ameliorate MS symptoms by modulating the inflammatory status of the disease, both in relapsing, remitting MS and in primary progressive MS. I was trying to really get to, I know they say, Western diets are categorized by high amounts of salt, animal fat, factory farm raised red meat, sugar sweetened drinks, fried food, and low fiber foods. So those are diets that you don't want.
Basically the do's and don'ts when living with MS.
So they say aim to eat a diet that is similar to the Mediterranean diet, which research shows help to reduce inflammation, protect cognitive health, reduce cardiovascular mortality risks, and improve endothelial functions. So what they suggest as far as a healthy MS diet is unprocessed foods. Choose whole, organic, unprocessed foods as often as possible. Coconut oil, which contains large amounts of medium-chain fatty acids that support the brain and nervous system. Olive oil is another healthy source of fat that is associated with cognitive health. Of course, your fresh fruits and veggies. Aim for a variety of colors to provide antioxidants that can help prevent free radical damage. I know they say just, even being diabetic, that it's better to eat dark leafy greens, and also eat, the fruits that are darker, or the berries, I'll say, like strawberries, raspberries, blueberries, things of that nature. Because certain fruits, even though, natural fruits are good, some of them you have to kind of watch and monitor because they have higher sugar in them. So I know for me, I have certain fruits I just can't eat right now because they have higher fruit, like mangoes and just pineapples, and it just really all depends. And even if you eat it, please eat it in moderation. And I know sometimes that could be hard because if you like natural fruit like I do, I like to get down. But we have to watch our sugar.
Yeah, you gotta watch your levels.
You gotta watch the sugar.
Watch
Seems
your
like
levels.
you have to watch salt, and that's
you gotta
just
watch a lot of stuff.
Right. And so they say here vegetables such as Brussels sprouts, broccoli, cabbage, cauliflower, bok choy, kale, and collards. They recommend that you eat those. They have what you need, the antioxidants and the nutrients that you need. They also say whole grains, herbs, your spices that you can get, your what is it? What I want to say, like, if you have a farmer's market, or there's probably some supermarkets as well that have like,
grocery stores can have it too. Depends.
Like the natural spices,
Yeah.
People I hear live by turmeric. I don't know if turmeric is good for individuals that have MS, but
I'm not sure, because that could cause inflammation because
right.
It's so strong.
It's very strong.
Yeah.
So there's just a list of different things. They say, the best omega-3 foods include wild salmon, sardines, trout, herring, mackerel. So they say probiotic foods includes dairy products like yogurt. If you can tolerate dairy, you can have some in moderation. But you have to be careful with that, with the dairy. Me, I cannot have any dairy. I'm lactate, so I do like coconut milk, rice milk, hemp milk, things of that nature, something that don't have soy. Like I can't have, like, it can't have soy based in it either. So it's just, you just have to do your best to do better by eating better. And if you can definitely make your own food, that is the best, instead of buying a whole bunch of store-bought. But if you have to do store-bought, just monitor and read and be careful, because some of that can have a lot of sugar in it too. Even if it's like vegan, if you're going vegan based, you just have to, it's just to a point in today's society, like you really just have to watch what you eat, regardless if you're eating meat or even vegan based or vegetarian based, because a lot of that has a lot of high salt and sugar in it. So yeah, so it has much more. It's going to get posted, so you can read it, the do's and the don'ts.
See, it's a lot of information.
Mm-hmm.
A lot of stuff that people can apply, like those diets, those the way you eat, like have a healthier eating habit, so yeah, I'm definitely gonna post it up for you guys. It will be on our Chit Chat Chew Instagram and Facebook, so be looking out for that. Now I wanted to touch on MS some more. I'm gonna actually do 2 articles. One is just a little brief summary on MS, and I wanted to touch on cures, treatments, and products or foods that can help reduce MS. So I will write off the back of Jade and add some more to the conversation. So this is coming from msif.org. I'm just going to read a couple of lines. Okay, so Jay touched on, MS far as, how does it develop? Where does it form from? What it does, cause and effects, et cetera, et cetera. I wanted to read this part here where it says, MS symptoms vary very widely and include blurred vision, weak limbs, tingling sensations, unsteadiness, and fatigue. For some people, MS is characterized by periods of relapse and remission, while for others, it has a progressive pattern. So for everyone with MS, it makes life unpredictable. Here's some quick MS facts. MS is a progressive disease of the central nervous system for which there is no cure at present. More women than men have MS, with a ratio of 3 women to 2 men. MS is the most common disease of the central nervous system in young adults. MS is not directly hereditary, although genetic susceptibility plays a part in its development. MS is not contagious or infectious. Diagnosis of MS is generally between 20 and 40 years of age, although onset may be earlier. There are a wide range of symptoms, with fatigue being one of the most common. The incidence of MS increases in countries further from the equator. There's no drug that can cure MS, but treatments are now available which can modify the course of the disease. Many of the symptoms of MS can be successfully managed and treated. So those was quick facts from msif.org. Now, getting to supplements and treatments and remedies. I want to read. I'll probably read this first one. Okay, well, yeah, I'll read this one. Okay, so this is coming from healthline.com. Okay, now they have a list of supplements that don't cover every available herbal or supplementary option for treating the symptoms of MS, but it can help. It can at least try to modify it if you can find it. So I'm gonna say them and then give you the importance of each one. All right, and even the most common herbs and supplements that's used by people who have MS. The first one is agrimony. Agrimony. So this is based on centuries of its use in treating a variety of health problems. It's attributed to the many different varieties of agrimony. It's discovered the antiviral, it has antioxidative, anti-inflammatory, and metabolism boosting properties. Okay, Amrit Kalash. Amrit Kalash. Now, this is a Ayurvedic food supplement used to promote immune health and slow the deterioration of the central nervous system. The next one is ashwagandha. Ashwagandha. So this Ayurvedic herb is known by many names, including Withania somnifera, it's Indian ginseng, and asana. Its berries, roots, and extracts are sometimes used for chronic pain, fatigue, inflammation, stress relief, and anxiety. The next one is astragalus, which is astragalus. This is a herb that's been used for centuries in traditional Chinese medicine. There's many species of this plant, but there's two typical ones they use for medicinal purposes. This is a long name, so I'm going to abbreviate. Okay, AM and AM. But I say AM two times because both M's of these words have different spellings, okay? So one is MEMBRANACEUS, and then the other M is MONGHOLICUS. According to the National Center for Complementary and Alternative Medicine, astragalus is safe for most adults but may interact with drugs that affect the immune system. This herb is thought to affect the immune system, liver, and heart, but there has not been enough research in humans to fully understand its effects. So that one you probably have to use really in moderation. Gotta be careful with that one. But although it could be used for medicinal purposes or have some kind of healing properties. Number 5, barberry. This has been used in the Indian and Middle Eastern medicine for easing inflammation, fighting infection, treating diarrhea, and calming heartburn. It can be used in many forms. It can also boost the immune system. So now they have another one called bee pollen or venom. Yes, bee pollen or venom. Okay, venom of honeybees is a clear liquid, and treatment of health conditions with the venom of bee stings is called apitherapy, which means, in other words, the venom is known as apitoxin. Unlike many others, well, unlike many other other herbs and supplements used to treat MS and its symptoms, bee venom has been specifically studied for its effects on MS in several clinical trials. Let's see what else they have on this one. Okay, so when they had trials on bee pollen or venom, the benefits were, let's see what they have. It's supposed to be, it's an antioxidant. It's an antimicrobial abilities. And those are two properties that it possesses. So, the next one is bilberry leaf, or also known as huckleberry. It's a relative of the blueberry and can be used for its fruits or leaves. Although it's often used in foods, the berries and leaves can be used to derive plant extracts for supplements and other medicinal uses. Historically, this herb was used to treat everything from vision problems and scurvy to diarrhea and circulation problems. The next one is burdock root, which his actual name is Archeum lapa. That's the real name, but it's commonly known as burdock. It's been used in traditional Chinese medicine and European medicine for centuries. It has the ability to promote circulation and reduce inflammation. And it's studied for its antioxidant and anti-inflammatory abilities and its potential impact on cancer, diabetes, skin conditions, and the gastrointestinal system. And I will read two more because it's way too many. So I'll stop at 10. But if you want to check out the rest of them, it's on Healthline. So please check it out. I see they have a lot that people can use for MS that could be really helpful to them. The next one is calcium. It's a crucial mineral for the body's health and proper function. So it's a common part in many diets. And of course, that's a common supplement that a lot of people use. It plays a role in bone health, cardiovascular health, and cancer risk. The proper levels of calcium is important because if you're an individual with MS and you're taking vitamin D or medications with calcium, you kind of want to, you want to just be mindful, be careful. You want to consult a physician, of course, before adding calcium to, with your whole routine of taking other medicines or supplements. Okay. Vitamin D increases the body's absorption of calcium. So see, that's the downside. Because you're taking in the calcium, but the vitamin D is going to eat it up. So that's why I say you should consult your doctor and at least try to get a balance and figure out what works and what don't work. And yes, you can overdose on calcium because calcium can be toxic. So be mindful of that. The last one I'm going to read is called catnip. Yes, catnip. It's not just for kitties. Some individuals use this herb for MS pain management. It has sedative effects, which may actually make fatigue worse or multiple the effect of other sedative medications. So again, you have to use this stuff in moderation. You don't want to overdo it. So those some suggestions they have for that. And let me see if there's something else might want to read. Then I think, did you mention oats and fish oil for MS? I heard you talking about natural remedies.
I mentioned, I don't know, I can't remember if I mentioned oats or fish oil, but I know that they were saying, like, as far as food wise, to eat certain types of fish. Like if you're going to eat salmon, eat wild salmon, and they I think mackerel and perch,
stuff like that. Yeah,
right. Mm-hmm.
Okay. I don't know why I kind of sound like you did say that. I don't know, maybe I heard another kind of oil and it just kind of clicked to make me think you said fish oil or something. But I'm not getting into detail with this article. I'm just going to list these 5, and any other research you can please do yourself. But this is coming from naturalhomemedies.com. So they have 5 natural cures for MS, which is flaxseed, oats, fish oil, vitamin D, and beetroot. So they do have some healing properties, some ways that can really moderate your MS. Because, you know, they are rich in whatever minerals and resources it may be. But if you want to find that out, please research this article, which we will post up on our Instagram.
Awesome. So I just kind of want to piggyback the importance of recognizing the symptoms for MS. It could be pain areas in the back or eyes. Pain circumstances can occur in the back due to head nod or with eye movement. Tremor can occur doing precise movements in the hands or limbs. Muscular cramping, difficulty walking, inability to rapidly change motions, involuntary movements, muscle paralysis, muscle rigidity, muscle weakness, problems with coordination, stiff muscles, clumsiness, muscle spasms, or overactive reflexes. The whole body could be fatigue, dizziness, heat intolerance, poor balance, vertigo, or weakness. Sensory falls under pins and needles, abnormality of taste, reduced sensation of touch, or uncomfortable tingling and burning. Urinary is excessive urination at night, leaking of urine, persistent urge to urinate, or urinary retention. Visual, blurred vision, double vision, or vision loss. Sexual, erectile dysfunction or sexual dysfunction. Moods, anxiety or mood swings. Speech, slurred speech or impaired voice. Also, what's common is constipation, depression, difficulty swallowing, difficulty thinking and understanding. Flare, headaches, heavy legs, numbness of face, rapid involuntary eye movement, sleep deprivation, tongue numbness, or difficulty raising the foot. So those are some of the symptoms. I just thought it was really important because if you have a loved one or someone that you know, and you might be recognizing these things, please, help them. Give them the tools and the resources on what they can do. Treatments would be physical therapy and medications that suppress the immune system. They can help with symptoms and slow disease progression. Medications, chemotherapy, anti-inflammatory. Of course, they have immunosuppressive drug and steroids. As far as for therapies, you have counseling, support groups, again, physical therapy and acupuncture. I believe in acupuncture. I've had it before when I was in a car accident, and it really did help. Self-care, doing some physical exercise. Of course, there's specialists that you probably would need to see based on the level of MS, which would be neurologist, a speech therapist, a occupational therapist, a clinical psychologist, a physical therapist, and a PCP, which is a primary care provider. So just, all those are important. I also, there was a link, but that's going to be posted up. That was one. So I had some other articles on natural remedies, the do's and don'ts for MS. And you may have, did you read from everydayhealth.com? Okay, so you guys, when we click on, it has some do's and don'ts for what you can take. And which you can take together, because like Uno said, even if it's like a natural alternative, sometimes they don't mesh too good with the pharmaceutical drugs, and so you just have to be careful about what you're putting together. Just make sure you do the research. You can read up on the articles, and as Uno said as well, make sure you consult your doctor and let he or she know what you are doing. Because MS is something not to be played with. And you want the best care for yourself or for your loved one. So yeah, just make sure that you're careful and mindful on what you do. So again, that article, the do's and the don'ts for natural remedies, came from everydayhealth.com. Okay, so those will be posted.
Awesome. Yes. Okay, so we can go on to the next one. I mean, did you have any other articles that you would like to read?
No.
Okay. Well. We will go on to the next one. I'm actually trying to click on this article. It's acting bougie right now. Seriously? At a time like this? Okay. There we go. All right. So we're going to go ahead and go to National Kidney Month. If that's all right with you.
It's cool.
Okay. So I'm going to read from davita.com. Of course, y'all know March is National Kidney Month. And DaVita is involved because they help to raise awareness for chronic kidney disease, or CKD abbreviated. A condition that 1 in every 7 adults aged 18 or older in the United States has, as well as people with end-stage renal disease, ESRD, who need dialysis or a kidney transplant. Kidney disease develops when kidneys lose their ability to remove waste and maintain fluid and chemical imbalance in the body. The severity of CKD depends on how well the kidneys filter waste from the blood. It can progress quickly or take many years to develop because there are little to no signs of the condition. Most people are not even aware that they have kidney disease until it reaches the later stages, including kidney failure. I wanted to read. Okay, so the question is, they ask, what can someone do to raise awareness of kidney disease? You can actually go to their website, taking the steps to raise awareness about kidney disease. They have a quiz on there, and you can make a pledge to get tested. You can send an e-card to encourage others, to do the same. They also have, okay, I will read this right here. So, all right.
Where are you reading from?
I'm reading again from davita.com. I just want to read this part here. Who should be screened for chronic kidney disease? Anyone 18 years or older with diabetes, high blood pressure, cardiovascular disease, or a family history of kidney disease should be screened for kidney disease. If you live in an area that is offering a free screening plan to attend, if not, visit your doctor and ask that you be screened for chronic kidney disease. And what is involved in a kidney screening? That is the question. Because there are often no symptoms of kidney disease. Laboratory tests are critical. When you get a screening, a trained technician will draw blood that will be tested for creatinine, a waste product. That's what it is. If kidney function is abnormal, creatinine levels will increase in the blood due to decreased excretion of creatinine in the urine. Your GFR, which means glomerular filtration rate, will then be calculated, which factors in age, gender, creatinine creatinine, and ethnicity. The GFR indicates the person's stage of chronic kidney disease, which provides an evaluation of kidney function. So that was just a little brief section about kidneys, about kidney disease. You can check out this website. Go to thevita.com, by the way, /kidney aware, where you can find out how you can get into raising awareness for kidney disease. They have also an overview too about the kidneys. They have scheduling about kidney screenings, and they have the stages of chronic kidney disease.
That's it?
Yeah, that's it. I just wanted to read, read certain parts. But I do have another article, but I want you to go ahead and read yours and let the folks know what's up.
I'm just going to jump into the nutrition part of it, since we kind of have the same resource with that one.
What's the website?
DaVita.
Same thing?
Yeah, but it's all good. I'll just kind of jump to the National Kidney Foundation, which is www.kidney.org. Again, this is the National Kidney Foundation, and this is based on nutrition. Diet and nutrition are an important part of living well with kidney disease. As your kidney disease progresses, your dietary needs will likely change as well. Click on the appropriate stage below to learn more about diet and kidney disease. Be sure to talk with your healthcare practitioner about your individual nutrition needs. And they have nutrition and chronic diseases, stage 1 through 4, which learn the basics. And they have a video attached with this as well. Nutrition and chronic kidney disease, nutrition for children with chronic kidney disease. Most patients in the early stages of kidney disease needs to limit the amount of sodium in their diet. Some patients may be told to limit protein in their diet as well. The DASH diet, often recommended for patients with kidney disease. Be sure to talk with your health care provider about your specific nutrition needs, which they have DASH diet. They have enjoy your own recipes using less protein, sodium in your CKD diet, how to spice up your cooking. So they have a wealth of additional resources to help you stay healthy with kidney disease throughout your diet. They also have, if your kidney disease gets worse, you may need to limit potassium in your diet. Talk with your healthcare provider about your specific nutrition needs. I think I've said it already. It says, here are some additional resources to help you stay healthy with kidney disease through your diet, which is protein. Variety and moderation is key. Carbohydrate, counting with chronic kidney disease. How to increase calories in your CKD diet. Cholesterol and chronic kidney disease. Dining out with confidence. Use of herbal supplements and kidney disease. Vitamins and minerals and kidney disease. What you should know about good nutrition. Your guide to the new food label. Spice up your diet. Food safety is a must. Cookbooks for kidney patients. And dairy and other kidneys. So they have all different types of links here to click on. I'm going to click on one. Dairy. The one that says, hope I got it. The one that says dairy. It's so much. Dairy and our kidneys, but I don't see what. Okay, there it is. Dairy and our kidneys. When it comes to dairy products in our everyday food intake, most people would say that they have milk or other dairy products daily, if not more. Milk, cheese, cottage cheese, yogurts, pudding, and ice cream are some of the favorite dairy products of young and old alike. Dairy products are naturally abundant in protein, B vitamins, calcium, potassium, and phosphorus. I'm going to say phosphorus. I think I'm close to it. All of these nutrients are important for our body's many function. Healthy kidneys help remove waste products and extra fluid from the body and help balance the levels of salt and minerals in the body. As kidney functions decline, protein, waste products, fluid, salt, and minerals can raise to unsafe levels in the body, and this might mean that dairy products must be limited. A closer look at these key nutrients in dairy foods will help those with decreased kidney function understand the importance of limiting dairy foods. So you have protein. They say dairy products are a great source of protein. Protein helps build muscle and maintain our internal organs. Protein also helps to heal wounds and fight infections. We need protein sources in our diet daily. So if protein needs to be limited due to decreased kidney function, it is important to balance the right amount of proteins from all food sources, including dairy, meats, eggs, nuts, and other non-meat sources. Some of these non-dairy protein sources are high in some of the other minerals that may also be limited, such as potassium and psoriasis. I might have that wrong. So it is I might be saying it wrong. So it is important that a renal kidney dietitian help plan with protein sources can be eaten and how often. They have calcium, phosphorus. I knew I was saying that thing wrong. I was trying. My apologies.
It's all good.
Phosphorus. Phosphorus is a mineral found in many foods and is essential for the formation of bones and teeth. It plays an important role in how the body uses carbohydrates and fats for energy. It helps the body use protein for the growth, maintenance, and repair of cells and tissues. Healthy kidneys help remove any extra phosphorus that is not used by the body each day. Reduced kidney function may mean that foods high in phosphorus need to be limited to control how much phosphorus gets into the bloodstream. High phosphorus levels in the blood can cause bones to lose calcium, becoming weak and brittle. High phosphorus blood levels can also cause skin to itch as the body is trying to get rid of it through the skin. Medicines called phosphorate binders actually help bind up phosphorus from foods while they are still in the stomach and help remove phosphorus from the body through the stool. Then they have potassium, they have B vitamins. They have, B vitamins might have been last. So I'll say, So I'm sorry. There's so much information. It will go well over our show. Yes. But I encourage you to further read the articles that are put up. And again, I just read from thekidney.org. Just some brief tools. Again, they have so many links that are that you can click on and read. So definitely in your spare time. And that was coming from the nutrition and chronic kidney stages 1 through 4. Of course, you go through, you can go through dialysis, transplantation, kidney stones. They have recipes. They have the DASH diet, which I actually, that's a link that I have to read off of.
Cool. Love the information. It's good to know. I mean, like you, I don't know everything either. So just to hear some stuff about MS and get more detail about the disease and what can work, what cannot work. So yeah, it's definitely helpful. Or especially for anyone that suffers with it or have a family member or a friend or whatever that suffers with it. So great information. I'm going to read from a website called WebMD.com. It's on kidney disease. So they have causes, risk factors, treatment, and recovery. The first part I will read is what your kidneys do. And this is when the kidneys are healthy. Keep a balance of water and minerals such as sodium, potassium, and phosphorus in your blood. remove waste from your blood after digestion, muscle activity, and exposure to chemicals or medications. Make renin, which your body uses to help manage your blood pressure. Make a chemical called erythropoietin, which prompts your body to make red blood cells. Make an active form of vitamin D needed for bone and other things. Acute kidney problems. If your kidneys suddenly stop working, doctors call it acute kidney injury or acute renal failure. So the main causes of acute kidney problems is not enough blood flow to the kidneys, direct damage to the kidneys themselves, or urine backed up in the kidneys. Also, have a traumatic injury with blood loss, such as in a car wreck, or dehydrated and your muscle tissue breaks down, sending too much protein into your bloodstream. Going to shock because you have a severe infection called sepsis. Have an enlarged prostate that blocks your urine flow. Take certain drugs or are around certain toxins. Have complications during a pregnancy such as eclampsia and preeclampsia. Autoimmune diseases when your immune system attacks your body can also cause an acute kidney injury. Then you have chronic kidney disease. Diabetes types 1 and 2 and high blood pressure are the most common culprits. High blood sugar levels over time can harm your kidneys, and high blood pressure creates wear and tear on your blood vessels, include those that go to your kidneys. Other conditions include immune system diseases. One, it could be lupus. Long-lasting viral illnesses such as HIV, AIDS, hepatitis B and C, urinary tract infections within the kidneys that could lead to kidney damage more than once. Okay, inflammation in the tiny filters within your kidneys that can happen after you have a strep infection. And polycystic kidney disease, which is a genetic condition where fluid-filled sacs form in your kidneys. Defects present at birth can block the urinary tract or infect the kidneys. One of the most common ones involve a kind of valve between the bladder and the urethra. So, drugs and toxins as well, such as lead poisoning. Long-term use of some medications include NSAIDs, which is non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. So those are two that could be harmful to your body if you're taking these medications and it cause damage to your kidney. And IV street drugs can permanently damage your kidneys. So yeah, that all this stuff can destroy your kidneys over time. I'm trying to see what else they might have. I'm trying to see if they had something else on here. Yeah, that's it. That's pretty much it. That's pretty a pretty short overview that was detailed as far as kidney disease and what comes with that. So yeah, that's interesting to know that other things can cause kidney failure as well.
Right. Yes, because we all know, like any of these over-the-counter drugs or even the ones that they prescribe for us, yes, they can do damage. They really can. That ibuprofen, and it's just ugly, all of that stuff. Oh yeah. So you just have to be mindful and you have to be careful.
It's just like, damn if you do, damn if you don't.
Exactly. Right. Who wants to sit and be in excruciating pain, and then you break down and you take some pain medication, but then, in the back of your mind, you're like, dang, is this, how is this going to affect my kidneys, my liver, my whatever, you know what I'm saying? So, right. It's a battle. It's a constant battle. Well, let me speak for me. Let me speak for me. It can be a constant battle. I normally don't take ibuprofen unless it's just like unless it's an extreme case. But even with that, it's like for that period of time, I'm like popping pills,
like
pain pills
candy.
like it's candy.
Okay.
And my body has gotten totally immune to it. So there's times where I'm like, even this past, whole week, there was times where I just dealt with it. It was hard. It was hard. But yeah, that's why it's so important to ask questions when you talk to these doctors. It's very important to ask questions. You don't have to always yes them to everything that they say. If you're unclear, or if they speak in that doctor language that you don't understand, ask them to break it down in simpler terms so that you can understand. You don't always have to accept. Like, it's good. You have the right to ask questions. You are your own advocate for yourself. So make sure that you do that. Just one more thing I just want to read as far as kidneys, and that's coming back from kidney.org, is that DASH diet that I was talking about briefly. And with that, you can look at the top at the menu, and they have so many things that you can click on, starting with home, going to prevention, kidney disease, patients, the organ donation, and transplantation, professionals, events, advocacy, donate. So any of those that might be of interest to you, you can definitely go to that. So this DASH diet, it's your guide to lowering your blood pressure with DASH, the DASH eating plan. So today's leading health organizations are heartily endorsing the DASH diet for the informed, health-conscious diner. The DASH, which stands for Dietary Approaches to Stop Hypertension diet, has been recommended by the National Kidney Foundation and approved by the National Heart, Lung, and Blood Institute, the American Heart Association, the Dietary Guidelines for Americans, and also forms the basics for the USDA My Pyramid. Studies on the DASH have demonstrated that the DASH diet helps decrease blood pressure, lowers the risk for heart disease, stroke, and cancer, and reduces the risk of kidney stone formation. The DASH diet is rich in fruits, veggies, low-fat dairy products, whole grains, fish, poultry, beans, seeds, and nuts. It is low in salt and sodium, added sugars and sweets, fat, and red meats. So then they have 3 different type of links that you can click on, which is learn more about the DASH diet, great tips to tackle the DASH diet, and you can check out a sample 3-day DASH diet meal plan, including recipes. The DASH diet is recognized treatment for hypertension, heart disease, and kidney disease. The DASH diet can slow the progression of both heart disease and kidney disease. If you already have chronic kidney disease, you should speak with your doctor and dietitian before starting any new diets, as you may have special restrictions to consider. The DASH diet should not be used by people on dialysis. Individuals on dialysis have special dietary needs that should be discussed with a registered dietitian. So this little example, which you'll see when you look up the article, it says this example is for a detailed DASH diet for a 2,000 calorie diet. So they have the food groups such as grain, your daily serving 6 to 8. Then they have, a serving size of what you can eat, which is one slice of bread, 1 ounce of dry cereal, half a cup of cooked rice, pasta, or cereal. They have veggies in another food group, which you could have 4 to 5 servings, and then they go into the serving size. Fruits, 4 to 5 servings. Fat-free or low-fat milk and milk products, 2 to 3 servings. Lean meats, poultry, and fish, 6 or less servings. Nuts, seeds, 4 to 5 servings per week. Fats and oils, 2 to 3. Sweets and added sugars, 5 or less per week. So that was just a little tidbit of that's a 2,000 calorie diet. Again, they have links where you can go further in depth further in depth about reading what the DASH diet is all about, the tips, and like I said, they have some recipes included in this DASH diet. So again, consult a doctor, dietitian, nutritionist, because a lot of people don't, what about if you don't do meat? Then what else could you do to replace that, to make sure that you get your proteins? A lot of people are lactose. They don't drink milk. So, is it cool to drink, the hemp, the rice, the coconut, the almond? I mean, it's just so many different types of milk. And honestly, if you have a little bit of patience, you can make your own milk. Like you can make your own non-dairy like milk, and you don't have to eat tofu because the soy is really not good. They do have,
it's really high too, rich in soy. Yeah.
And they really do have other alternatives that are better, in my opinion, from on my journey of veganism, so to speak. They have other alternatives that unmeat really does taste good. It's really all in your seasoning. You don't have to do a lot of seasoning. You can put,
but you make it taste like meat.
You can make it taste like meat. Right. And so cooking for yourself, I know, is so much better, which is something I have to practice more of. But it is better if you see what you're cooking, because then you'll know how to monitor it, what to put in it, what not to put in it, and definitely it's so important to eat your veggies and your vegetables and your fruits, and drink water, even if it's salsa water, if you want a little flavor. Yeah, we got to monitor that, and monitor, your alcohol intake. A lot of that really does play a factor. Maybe once upon a time we didn't see it, but now that, through the years, society has changed, a bunch of chemical stuff and just a bunch of processed stuff, and they really don't want you to eat good. That's in their plan, in my opinion. That's in their plan.
The whole point is to destroy humanity. That's the whole point. Whether it's slow or fast. Mm-hmm. But it's up to us as humankind to make a choice. Either you want to turn that around, or you want to keep going down that path where it's destroying yourself. So it's poison until we put it in our bodies.
True.
So you just have to watch what you eat. Be more conscious of what you eat.
Yeah, that's very true. You just have to stop making all of the excuses, and you have to be accountable for yourself, because at the end of the day, in numerous conversations, it starts with you.
It does, but you know what? Sadly, some people don't really care to take accountability for themselves. They just want to do what they want, eat what they want, and they wonder why they're in the position they're in. So who's to blame for that?
I mean, sadly, it is their choice.
But that's something they have to live with.
True.
So it is what it is with that. But what you were saying, the piggyback off you, I wanted to add, you was talking about ways you can, monitor health-wise. Far as, managing your kidneys the right way. And even you kind of apply some preventions in there as well. I wanted to add some things you can reduce the risk of developing any kidney disease. So it's just really brief. It's coming from MayoClinic.org. And the 4 things they say is just to follow instructions. If you take over-the-counter medications, if you have to take it, okay? So, when using non-prescriptions, pain relievers, you have aspirins, which is, ibuprofens, Advil, Motrin, others, whatever. Then you have the acetaminophen, which is Tylenol, etc. You just follow instructions, far as what's on the package. Don't take too many, because that can really lead to kidney damage. Mm-hmm. You don't want to overdo it. And you want to ask your doctor, whoever you go to, is it safe for you? That's it, for 1. Now 2, you got to maintain a healthy weight, which is very true, because that does make a lot of difference when you having a better diet. I keep trying to tell people that. I mean, you can't try to look a certain way and don't maintain a healthy lifestyle at the same time. You not only you should be okay mentally, you need to be okay physically. All of it works hand in hand. So if you're at a healthy weight, it says work to maintain it by physically active most of the days of the week. If you need to lose weight, talk with your doctor about strategies for healthy weight loss. Don't smoke. That's the third one. That's very important to prevent any kidney disease. Cigarette smoking can damage your kidneys, make existing kidney damage worse. So that's the last thing you want to do. If you already suffer from some kind of kidney failure, you don't need to add on. Okay? If you're a smoker, talk to your doctor about strategies for quitting smoking. They have support groups, they have counseling, and they have medications that can help you stop. And the fourth one is manage your medical conditions with your doctor's help. So if you have a disease or condition that increases your risk of kidney disease, work with your doctor on how to control that. Ask your doctor about tests to look for signs of kidney damage and any way that you can stop the developing stages of kidney failure. So that's what I wanted to read from that. So from what you said, Jay, for what I said, is all great information that we all can learn from and make our lives better too. You don't have to be someone who's suffering from kidney damage to not apply this to your life, because anyone can end up in that situation. So we have to be mindful of our bodies and what we put in it. I know it's hard for a lot of people because they're so used to eating what they want to eat and doing habits that they're so used to doing and living a lifestyle that they want to live. But, there all comes with consequences at the end. Later on down the road, it catches up with you. So at some point, you got to, try to get conscious of your body and watch what you put in it and knowing the effects of it. Because, if you just going through life and just putting damage to your body, that's it.
And the favorite that I like that some people say, well, I'm going to die of something anyway.
They always say that, which is true. You absolutely right. But why speed it up? That's the thing. Why speed it up?
Well, why can't you just transition due to just natural causes?
That's what I'm saying. Right. Why speed it up? Why? You're right. That so
like
by you saying
you
that,
just dying, you just transitioning because
old age or whatever
older
it may
age
be.
or just I don't know.
Why it gotta be because you don't smoke or you took too many medications or you eating the wrong foods or whatever you doing to die quicker than you have to. So you made a good point, Jay.
It just kind of popped up in my head.
But it's true. It's real. It makes sense. So, okay. Is there something that you would like to read?
Well, I don't have anything else for kidney. And respectfully, if you have something always interesting, can I pick one from the next? Okay.
Go ahead.
So I wanted to go on to our next, which would be, we're getting back into the saving your vision in the workplace, which is very important too. Save your vision in the workplace. So I'm just kind of randomly picking. Okay, it's for the month of March. It's Save Your Vision Month, because based on, well, really just in general, some places, they have to wear certain protective eye gear and things like that. So I wanted to read from healthstatus.com. Again, healthstatus.com. Make the most of Save Your Vision Month. Save Your Vision Month is held every March and aims to increase awareness regarding good eye care. Organized by the American Optometric Association, The main focus of this event is to encourage more people to go for regular eye exams. With computers becoming an everyday part of people's lives, the risk of eye strain and damage is higher than before. Apart from ordinary eye care, this month especially focuses on eye care in the workplace, with an emphasis on employers to take eye care and health seriously. Taken for granted. Save Your Vision Month reminds many people of a rather shocking thing, that most of us take our vision for granted. Seeing is one of the easiest things to do in the world. You just have to open your eyes. Apart from that, so much of our lives are based on visual stimulation. From work to entertainment, our eyes form a large part of our everyday lives. Unfortunately, most of us don't think about actual eye care until something goes wrong. It's important to note that just like visiting the dentist regularly is important, regular eye checks are also important. Some of the benefits of regular eye exams are very apparent. For instance, if the power of your eyesight is decreasing or faulty, corrective measures can be taken immediately. Let me see. This is much healthier compared to putting up with eye strain until it becomes a real problem to see. Eye checks can also tell you a lot about your general state of health. For examples, diabetes is very often diagnosed via an eye exam. Other diseases like glaucoma can be quickly detected and treated by going for regular eye tests. Eye care at work. Today, almost every workplace is fitted with computers, whether it's a corporate office or a small library. One of the biggest problems of continued and persistent computer use is eye strain. Many people who use computers for long stretches of time tend to complain about symptoms like dry eyes, blurry vision, and eye strain. While it might not be feasible to cut down on computer use, there are a number of ways to maintain good eye care and health while you work. First of all, regular eye exams are a must, and it's important to tell your doctor how much computer work you do each day. When using your computer, make sure you stop for breaks at regular intervals. It's a good idea to just get up and walk to a window and just have a look outside. Allowing your eyes to look away from the screen, particularly at something soothing, can be very resting for the eyes. One problem many computer users face is a problem they probably aren't even aware of. That is the fact that they don't blink. When staring continuously at your monitor, you will blink a lot, less than normal. This is what causes the problem of dry eye. Where am I? Okay. When working at your computer, make a conscious effort to blink as much as possible. In fact, closing your eyes for a few seconds can really help as well. If you still face a problem, consider buying artificial tears and applying them to keep your eyes moist. If possible, install a humidifier in your work area. The way you sit at your computer also plays a big role in your health of your eyes. Make sure the monitor is about 20 inches away from your eyes. The top of the monitor should be tilted a little below your eye level. Also, make sure that you keep your monitor free of dust and fingerprints, as these can greatly reduce clarity. Lastly, remember that eating healthy can indeed improve the health of your eyes. Eating plenty of fresh veggies and fruits, as well as getting a good night's sleep, are all important ways to preserve the health of your eyes. During this Save Your Vision Month, it's important to take the necessary steps towards better eye care. If that's not speaking to me, I don't know what the hell is.
And me too, G. My 4 eyes.
And my 4 eyes. So, I know I need to go get a good physical. I already got that. A good eye care, which when we come back from this vacation of ours, it is definitely on the bucket list to do, because right now I'm just with reading glasses, but I try my best to get up and not sit there straight 8 hours, because that would just be horrible. I try to make sure that I get up. I not only stretch my legs to keep the blood flowing and things like that, but just get away from that desk, because you can get caught up, whether you're in corporate America at work, or even if you have your own business and you're sitting at your, you have your laptop in front of you, or your desktop computer in front of you, and before you know it, you get so caught up with being on the computer that time and hours have passed by, and your eyes are like crazy, and it's true, your eyes can become blurry sitting there for so long. So yeah, get up, stretch, look at something, just look out the window like it said, or do something else to just kind of change the pace for a little bit, and then once you're done, you can go back and you can revisit it. Also very important, as most of everything, not most, but everything that we read, your diet is so important. Like what you eat is so important. Incorporating vegetables, even if you can't afford to get fresh vegetables, frozen ones are good. I don't encourage canned because it has so much sodium, but if that's all that you can afford, who am I to say don't get it? I don't know. Open it up, drain it out, wash it real good, or whatever.
I was about to say, leave it in the juice. That's all
right.
you gotta do.
But they got good frozen vegetables. That's reasonable. That you can, even if you can't afford fresh fruit, you can get frozen fruit.
Yeah.
Heck, you can get a blender and make juices or smoothies
yourself without having to buy it.
And you don't even have to. I mean, you'll spend less doing it yourself than going out here to Smoothie King. Not to say nothing's wrong with Smoothie King.
Every day that money adds up.
Right, I don't know about your pockets, but my pockets every day, that adding up is expensive. Okay, so make it easier for yourself when you go when you're purchasing, when you're doing better to learn how, when you're doing better with eating. So yeah, it always goes back to the diet that you have, because that does play a large part. If you're not incorporating that in your life, then yeah, that affects like the dark circles or bags up underneath your eyes. You know what I'm saying? I know a lot of times it can be genetic. Mine's is genetic. However, I have noticed that sometimes they will, underneath my eyes, it will get a little darker. And I know that's one, because that means I'm not incorporating enough dark leafy green vegetables and fruits into my life, and even drinking enough water, and also lack of sleep. That's something I struggle with, lack of sleep sometimes. So it's just self-care. Can't say it enough. Self-care. Hell, ketchup has sugar and salt. It's crazy how when you just take a moment to read these different labels, how stuff that you really didn't think would have like high sodium and sugar, like ketchup, that tripped me out a little bit when I found out like ketchup has so much salt and sugar in it, and you have to be mindful. And a lot of times the stuff that say no salt, it tastes disgusting, let's be honest, but maybe we can be creative and think of other ways to like make a dip, a dip or something to help.
That makes sense. You can like finding creative ways to intake things.
Mm-hmm.
I mean, yeah, it's all how you do it, man. You gotta work within your budget, but you still want to maintain a diet that can help you though in the long run, but at the same time it's not breaking your pocket. So finding that balance financially and health wise.
That's true.
So for Save Your Vision Month, I do have, that's what we're doing, right?
Mm-hmm.
Okay, just want to make sure. March. Okay, so I have a article coming from coopervision.com. It's a summary of Save Your Vision Month. It gives you a little detail on routine eye exams and, the risk of losing your vision or whatever, and when to get eye exams and how can eye exams be helpful to your eyes. So I wanted to read that article real quick. It's really brief. It's not long. March is Save Your Vision Month. While you may think that having good vision means that your eyes are healthy, that may not always be the case. Getting your eyes checked regularly by an eye doctor can ensure that you not only have great vision, but that your eyes are healthy too. Getting an eye exam is the first step that you need to take to save your vision. Older Americans are more likely to be at risk for significant vision loss or blindness from age-related eye diseases, such as cataracts, diabetic retinopathy, glaucoma, and macular degeneration. Routine eye exams are important for everyone, no matter what your age is or physical health is like. For most of you, think of it as a regular checkup to ensure your eyes are healthy and that there are no early signs of eye disease. Some eye diseases have no physical symptoms early on, so getting an eye exam is the only way to detect them and treat your eyes before your vision gets infected. Regular eye exams are a great way to track normal vision development in children. Eye exams help parents understand if their children need vision correction as well. Children with uncorrected vision face academic, social, and athletic barriers. By ensuring your child has high quality eye care, you can break these barriers down. Eye exams not only help you achieve great vision and healthy eyes, they can also help detect systemic diseases earlier. Your eye doctor can detect systemic health issues such as hypertension, high cholesterol, and diabetes. During an eye exam, your eye doctor has an unobstructed view of the blood vessels in your eyes. This allows your eye doctor to see signs of these chronic health conditions that you may have. So make sure you save your vision and take the time to book an eye exam this month if you haven't already, and if you haven't already had an eye exam this year. Now I will speak on me. I have not had an eye exam this year, but I will plan to definitely this year. I want to, so I'm definitely going to, because I do need a updated eye exam because I haven't had one in a while. I was actually supposed to one because I got a call from Walmart. Yeah, so because Walmart does prescription, they do glasses, do eye exams. I actually got a call. I never follow back up. So whether it's the Walmart or not, I will make sure that that I get my test done on my eyes, and if need be, I will actually get an extra pair of glasses or two just to have a backup. But that definitely is important because I still want to know what's going on in my eyes. Has it changed? Is it still the same? Do I have any occurrences that I have no knowledge of about my eyes that's going on, just health wise? So it's good to know what's going on with yourself, period. Definitely your eyes, because the last thing you want to do is be blind. Okay, that's a scary feeling for some people. So you always want to get them eye exams so you can detect what's going on early, and you can prevent it, you can stop it, and you can at least live your life, accordingly. So yeah, I just wanted to say I need to go get an eye exam. It ain't gonna be this month, but it's gonna happen, God willing. And I think that's it. I mean, it's not. I think I do have one more article and I'm done. I don't really have much to say about Save Your Vision Month, but I do have one more. But I will let Jade tell us. I want to read what you got.
This is really.
Hear what you got. I'm sorry.
This is really short, and this is really short. But May is considered Healthy Vision Month, but this is just an add-on to Save Your Vision because you could start doing it now instead of putting it off. This is coming from the National Eye Institute, short for NEI. So it's nei.nih.gov. Again, that's from the National Eye Institute, NEI. And they have a National Eye Health Education Program, which breaks it down. They have a homepage. They have about what NEHEP program is about, the partnership, if you're diabetic, eye disease, glaucoma, low vision, vision and aging, right the vision, training resources, newsletters. So this is, even though May is Healthy Vision Month, you can start on that now, and they have plenty of resources. I mean, like forever, like Healthy Vision Month website, Healthy Eyes Toolkit, Healthy Eyes webpage. So please, just real quick and brief, it says May is Healthy Vision Month, but again, I encourage you to start reading, following up on this now. It's a National Eye Health observance established by the National Eye Institute, NEI, which was established in May of 2003. NEI is one of the National Institute of Health, an agency of the U.S. Department of Health and Human Services. Healthy Vision Month is designed to elevate vision as a health priority for the nation. Millions of people living in the United States have undetected vision problems, eye diseases, and conditions. Please join us in educating people in your community about the importance of comprehensive dilated eye exams in maintaining eye health and preserving sight. So that's only really what I wanted to read. It's just, it has just that little bit, but the links, yeah. They have lots of links, resources, and materials for you to further read, because our eyesight is so important. And I'm telling you, if you live long enough and you get older, you can't say what's not going to happen, because you just never know. So it's good to start where you're at now, and there's resources, and they probably, maybe you can't afford it. They have, I'm sure that they have like places, based on where you stay. It might have resources for, based on income. You just never know unless you ask. Closed mouth don't get fed. Closed mouth don't get help. So it's good to open your mouth. We open our mouths for everything else. Let's open our mouths for our healths. Our lives, hashtag our lives matter. For
our
real.
lives matter. Let's make this a advocacy. Let's make this a movement, because it's so important. It has to be addressed.
And I have to be accountable for myself too. So when I say I say it for myself too, especially if I'm not up on my game as well.
Absolutely. Is that all you had to read from that?
For this, yes, for that particular one.
Okay. Yeah. So I have one from no. Yeah, I hate these pop-ups that give you suggestions, or you gotta sign up for something, blah blah blah. But this is coming from BelmaraHealth.com. It's actually 11 home remedies to improve eye health. Okay, so they have acupressure for eye health. So that's applying pressure points in the body to boost circulation and promote healing. So it's similar to acupuncture, but you just use fine needles. Fingers target the healing points. But that is an effective way to improve eyesight. We also have eye-friendly nutrients, and that's through diet. So there's some beneficial foods and diet-packed stuff that has the nutrients that you need. So they have rich vegetables like carrots and omega-3 fatty acids, which supports healthy vision. They have other beneficial nutrients, like vitamins A, B complex, C, D, and E, as well as beta carotene, amino acids, and other antioxidants commonly found in leafy greens, berries, and carrots. Bananas and kale is too, that provides the nutrients for better eye vision. spinach, collards, turnip greens. They have high amounts of antioxidants that helps healthy vision. You have, of course, you exercise for your eyes, so you have to exercise them eyes, okay? Because that helps improve the focus and concentration while you are trying to combat eye strain. So, glaucoma risk and retinal degeneration progression can be reduced with physical fitness and aerobic exercise. Exercise is to ward off vision problems, and also if you're diabetic. Okay, so definitely something I recommend if you suffer with eye vision. You can try that. It might be helpful. You just never know. Healthy daily habits. Okay. Me and Jay mentioned more than once that health is important, like eating a good diet or a healthy diet that can help improve on the ailments that's plaguing your body. Okay, so you gotta get a lot of sleep too. Jade, I know you mentioned deprived of sleep, so that's definitely important to not deprive yourself of sleep. That's important to get sleep because your eyes need a rest too. Everybody just think the rest of your body needs to rest. Your eyes need to rest too, because if your eyes are not resting, how your body gets affected when you don't rest enough, your eyes get affected too when you're not resting it with the body enough. So now you have to work extra hard, for the body to keep up. Okay. Now, there's methods that you can practice that can help you with sleeping. Find a way to tackle those methods. If you got research, go to a doctor. Whatever you got to do, please do it. Now, if you wear glasses, you got to make sure your prescription is up to date. So, again, eye exams are definitely important so you can be up to date with your prescription. Because if not, if you prolong it, it could be a possibility. Not saying it's definite, but it could be a possibility that can cause more harm to your eyes. So you always want to get eye exams on a regular basis, because your eyes change. They don't always stay the same. Your body changes all the time, so your eyes is gonna change with the body. Cool your feet. You gotta cool your feet. Be near an air conditioning unit. You wanna, focus that air on your feet instead of your eyes. That's maintain the moisture of your eyes so they don't dry out too quick. And of course, dry eyes could be not comfortable at all. So that could lead up to eye infections and ulcers. Walk 40 minutes. That's definitely important to walk, because circulation. Eyes do need circulation. Being physically active can help reduce the symptoms of glaucoma. Over 20 years of research in glaucoma patients found that walking briskly for 40 minutes 4 times a week reduced intraocular pressure significantly, the primary cause of glaucoma. Take a break. That's important. If you work long hours in front of a bright computer screen, Jay, you mentioned something about computer and being in front of a computer screen and what that does when you are around it so long. So extended hours exposed to artificial light increases the chances of becoming nearsighted. So it's in your best interest to get up from your computer desk more often. Jay, you mentioned getting up from your computer and do some walking, stretching, whatever you had to do to get away from that computer screen, because that does affect your eyes.
Yes, it does.
So, getting up, walking away for at least an hour, that prevents fatigue too and eye strain. And also get tested for glaucoma, okay? Because that's a serious eye condition and affects a lot of people. And that's the leading cause of blindness, and it's caused by rising pressure within the eye itself. So you want to get the early diagnosis from your eye doctor. So please get up on that. Get the treatment you need if the doctor do possibly find something. Because waiting too long, having some kind of disease or ailment or condition can have some damage that can be moderated, sometimes cured, but a lot of times irreversible. You can't cure it. You can't heal it. You can't fix it. Once it's messed up, that's it. Especially when it comes to your eyes. You ain't much you can do with that. So you got to really take care of your eyes.
That just make me think about
what you are being silly about with yourself.
That make me think about how they say people who have, not all, people who may have glaucoma, they smoke some weed and it really helps their vision.
Hey, it probably do help their vision. That's a good blunt. I need that. I don't smoke, but I might need it.
I really, for medicinal purposes, some people have said they've smoked weed, or for the people who want to be like marijuana, it helps with their eyes.
Folks so damn bougie. They damn gone somewhere with they sell.
Now, black folks, we call it weed, honey.
Right, that weed, that good blunt, bro. Smoke you a good blunt, you all right.
But yeah, I'm being silly. I'm tired.
Obviously, I could tell you tired.
I'm in a little pain, and actually, my eyes hurt. Yeah, my eye, which I definitely, when we come back, definitely going to be accountable. Because I said 2018 is my journey to heal mentally and physically. And so I got some work cut out for me. And one of the bucket list goals is to get the eyes, go to a real eye doctor. Okay. And get some good glasses, because my eye is jumpy. My right eye is jumpy, and I don't know what that's about. I can remember my dad, may he rest in transition well, that his eye was jumpy. And that's kind of hereditary. And it's crazy because the right eye is a little bigger than the left eye right now. Just came out of nowhere where that just happened. So yeah, I don't want to start getting into my thoughts, and the anxiety gets high and I start panicking like, oh my God, help.
The best thing to do is catch it early.
Gonna be accountable for the eye appointment. Yeah, it just made me think about that glaucoma thing, how funny that was. Because some people actually be like, I've heard them, young or old, say that for medicinal purposes or not, they just smoke their weed and it helps their vision.
Ain't nothing wrong with it. You
no judgment over here.
You do what you gotta do. But yeah, so that's that. And I wanted to read these last three. Eat sunshine colored foods. So any food that is yellow or orange in color, that this can include egg yolks and a wide variety of yellow or orange vegetables such as carrots and pumpkin, because those foods contain vital nutrients that help protect against age-related macular degeneration, or abbreviated for AMD. And we all know the most common cause of blindness, in old people, so is AMD. But dark green vegetables like kale and spinach and broccoli, they all have benefits. So I suggest if you suffer with eye problems, try these methods. They just might work, and I believe they would. Get wraparound protection. This refers to wearing glasses. While the sun may be great on the skin, its rays can have a damaging effect on the eyes. That's true. That thing be beaming on your eyes, look like
right.
You be seeing stars and other lights and think it's an alien beaming on your eyes or something.
Monkeys and tigers.
Right. But it's piercing through your eyes, though.
It is.
That can damage your eyes.
That's true.
So the result is of the sun's ultraviolet rays. Wearing sunglasses also protects against the dry effects of the wind and against pollution. Okay, so they recommend the kind of sunglasses you should wear. 99 to 100 UV protection with large lenses able to protect against more harmful sun rays. Lastly, lower the screen. A computer is vital for most people. Bright screens are often used for both work and play. You can help reduce chances of dry eyes by simply positioning your computer screen below eye level. This will position your eyelids in a way that minimizes fluid evaporation. When it comes to protecting your vision, there are many home remedies out here. So yeah, like it said here, start today and you'll see results. So start it. You just never know where it might take you. It might change your life for real. It'll change your life. And this is coming from BelmaraHealth.com.
Boy, the stuff that you can learn. I'm telling you.
You ain't lying.
So this small article that I have is from Prevent Blindness, which is preventblindness.org. Protect your vision on the job. Prevent Blindness declares March as Workplace Eye Wellness Month to educate on ways to protect vision on the job. It says Prevent Blindness has declared March as Workplace Eye Wellness Month to provide employers and employees with free information on the dangers of blue light, digital devices, and vision, and eye injury prevention in order to promote eye health at work. The largest source of blue light is sunlight. However, there is concern over the long-term effects of screen exposure from television screens, computer monitors, smartphones, and tablet screens because of the close proximity of the screens and the length of time spent looking at them, such as during the workday combined with leisure time. Early research shows that too much exposure to blue light could lead to digital eye strain, which is fatigue, dry eyes, bad lighting, or how one sits in front of the computer can cause eye strain. Symptoms of eye strain include sore or irritated eyes and difficulty focusing. Retina damage. Studies should suggest that continued exposure Studies suggest that continued exposure to blue light over time could lead to damaged retinal cells. This can cause vision problems such as age-related macular degeneration or cataract. And they look like they have a website to that. According to a recent report from the Vision Council, blue light exposure and digital eye strain, 87% of survey respondents use digital devices more than 2 hours per day, and over 52% regularly use 2 digital devices simultaneously. Once again, Prevent Blindness is partnering with Healthy and its eye-safe technology. Healthy will donate a portion of the sales of its eye-safe product exposure to harmful digital UV and high-energy visible HEV blue light emitted from such devices to prevent blindness in support of its children's eye health programs and resources. As we spend more and more time on digital devices at work or at play, we need to make sure we take care of our vision, says Hugh R. Perry, President and CEO of Prevent Blindness. By talking to an eye care professional and getting the proper recommendation, we can make sure we protect our eyes for the future. To help prevent an eye injury at work, Prevent Blindness recommends know the eye safety dangers at work, complete an eye hazard assessment, eliminate hazards before starting work, use machine guarding, work screens, or other engineering controls. Use proper eye protection such as non-prescription and prescription safety glasses, goggles, face shields, welding helmets, or full face respirators. Prevent Blindness also offers a work safety module as part of its free program, the Healthy Eye Educational Series. Each module in the series includes a presentation guide and corresponding PowerPoint presentation on the relevant eye health topics such as adult eye disorders, eye anatomy, healthy living, low vision, and various safety topics. Fact sheets can be downloaded at any time from the Prevent Blindness website for use as handouts to accompany the presentation. So if you want to find out more, they do have a toll-free number here. They have a place where you can download a copy of the Workplace Eye Safety press release. So I just want to read that. Actually, my eyes are really bothering me right now. So I'm squinting with glasses on. So again, that came from preventblindness.org.
Okay. I have an article from Atlanta2020.com. For this, let me clarify this, just because in case anybody missed it. This is for Workplace Eye Wellness Month. This is what we're covering now. Okay, so workplace eye injuries are extremely common. The National Institute for Occupational Safety and Health, NIOSH, estimates that each day 2,000 U.S. workers sustain eye injuries on the job. That's roughly 43 eye injuries every second. Certain occupations are at partly high risk for eye injuries. Generally, these jobs that involve chemicals, UV, or excessively bright lights, or the use of machinery or equipment that cuts, drills, ponds, sprays, welds, or generate a lot of dust and debris. Some of the most dangerous jobs in terms of eyes include auto mechanics, carpenters, electricians, factory workers, janitors, laboratory researchers and technicians, plumbers, welders. Safety experts and eye doctors, including Dr. Ashraf, believe using proper eye protection can lessen the severity or even prevent 90% of these eye injuries. So, the fact is, with almost every on-the-job eye injury, the injury occurred either because the employee was not wearing eye protection or the right kind of protection for the particular job. Now, the headline reads, Workplace Eye Safety, not just a concern with industrial jobs. The fact is, it's not only the industrial workplace that can damage a person's eyes. Office workers, too, can harm their eyes while at work. This is especially true for individuals who spend the majority of their work days in front of a computer screen. Computer vision syndrome, CVS, is the catch-all term for eye problems caused by extended periods of time in front of a computer screen. CVS affects between 60 and 90% of office workers. Additionally, children and teens who frequently use smartphones, tablets, e-readers, or computers, or play video games for extended periods of time are also susceptible to CVS. Computer-related eye problems are more likely to occur in people who already have an uncorrected vision problem, such as presbyopia, farsightedness, and astigmatism. These symptoms can be a result of poor lighting, being too close to the screen for too long or for a period of time without a break, poor posture, and excessive screen glare. Although CVS is likely to cause long-term irreplaceable damage to the eyes, it can lead to periods of blurry or double vision, dry eyes, red eyes, and eye pain, as well as headaches, neck aches, and shoulder pain. So, to reduce the impacts of computer vision, you take a 20-second break from working on a computer every 20 minutes. During your computer break, try to focus on something at least 20 feet away. This gives the eyes a chance to rest and allows them to focus on far objects, preventing fatigue. Dr. Ashraf also advises people who work on the computer for extended periods take time to make sure that they are blinking adequately. Blinking ensures that your eyes stay lubricated and affect washing your eyes with therapeutic tears, and is also the eye's way of resting for a brief moment. Other steps to combat CVS: use proper lighting, avoid excessively bright light, and balance your ambient light using fewer or lower intensity bulbs. If possible, avoid working under fluorescent lights. Modify your computer monitor and workstation. Minimize glare and upgrade your computer monitor to an LCD screen, which is easier on the eyes. Keep your monitor at least 20 inches away from your eyes and move the screen so you're looking slightly down at it. about 24 inches from your face. Adjust the screen display settings to where they are comfortable, including resolution, flicker, font size, brightness, etc. While in front of your computer, don't be too intense with your gaze. Visually take stock of the room around you to keep your eyes in constant motion. This allows your eyes to focus on things at various depths. You can also focus on something else in the room for a few moments. Simple eye exercises like rolling your eyes around in circular motions are also beneficial. This lubricates your eyes and eases muscle pain. Also consider getting computer eyewear. Come in for an eye examination and Dr. Ashraf this doctor, wherever state he's in, he prescribes those kind of eyeglasses. But I'm sure all across the United States, you can get special glasses just for computers, like being around computers, so computer eyewear. So you can view the computer screen. And that helps to reduce eye strain. And these precautions and exercises of the eyes, people, will keep your eyes healthy and your workday productive. So, I just wanted to read those brief parts about having eye health at work and practicing that in your life while you go day to day through work. Is there anything else you'd like to read, Jay, before we wrap this up?
No, I don't have anything else. I had other articles, but I really, my eyes, being honest, my eyes are bothering me right now. So any other links that I may have had in reference to taking care of your eyes while you're in the workplace, or even if you have your own business, taking care of your eyes while you're in your own business, it's important across the board. I'll just share those so that they can be posted up.
Well, okay, I don't have no other articles. I mean, it's not much to say with that topic, so we can go ahead and wrap it up.
Oh, can I? Okay, so what I will say, we had one more, but I'm honestly, you got to forgive me in advance. I'm just, my eyes hurt, so I gotta take care of my eyes. But our last topic of discussion would have been, is also brain injury awareness. And so,
brain injury awareness.
You want to read that?
Yeah, I can at least touch on one.
I think I have.
I'm gonna touch on one.
I think I have one that I'm probably.
I forgot all about brain injury, y'all. I'm tripping. Okay, so
I'll let you read yours, and then I'm just gonna post mine's up. I'm really just gonna post mine's up.
Okay. I'll just wait for this to load up. All right. So this is coming from missoulin.com, which is MISSOULIAN.com. Okay, so the headline reads, Brain Injury Awareness Month projects unmasked invisible injuries. Okay. Now, this says almost every mask each made by Montana with a brain injury on display at the Mosilla County Courthouse comes with an explanation. Some are bright, cheerful. Some are darker, streaked with blood red paint. The 20 masks will be up in the courthouse all March Brain Injury Awareness Month for two reasons. Two reasons is to promote awareness of the fact that Montana shuffles between second and third in the nation in brain injury related deaths, and to call attention to the fact that a statewide helpline is losing funding. And quote from the Montana Brain Injury Alliance Director John Bigart through an email. He says, we have helped thousands of Montanans and their families that have been impacted by brain injury. We may not be able to change the cancellation of the brain injury helpline contract, but we can be a voice to show just how much cutting the helpline that is devoted to helping brain injury survivors will hurt our state. The Unmasking Project plays on the idea of brain injuries as invisible injuries, Bogart said, because people can look fine on the surface but still severely injured. While Montana's brain injury-related deaths are in the top 3 in the nation, more than 30 Montanans sustain a brain injury every day and survive, he said. Those survivors are the ones telling their stories through the Unmasking Project, which will tour the state throughout the year. There's a story behind every mask. Behind every mask, there's a person that touches by brain injury. The Brain Injury Helpline has helped thousands of Montanans in its 12 years of service, Bogart said, with a range of questions for how they and their families live with brain injury. Those injuries have become more relevant recent through CTE, a brain injury that has been linked to playing football, Bogart said, along with increasingly common concussion protocol in all sports. The helpline will lose its $100,000 state contract at the end of March, ending the service for the immediate future. DPHHS funding for mental health targeted case management for adults and children will decrease by just shy of a million each year of the 2-year budget for targeting case management for people with developmental disabilities. The state is ending contracts with service providers. The Brain Injury Alliance will go after grants and private funding to try and start it back up, Bogart said. These budget cuts may be necessary, but they are affecting much needed services and ultimately hurting many of the people that we work with. Bogart said it shows just how much we need to push brain injury awareness and prevention. And I wanted to read that. I thought that was an interesting article. The way he took the approach to trying to raise awareness for brain injury, but also bringing more support to that cause and just how people are affected with brain injury. Okay, and I just want to read this last part. This is coming from, how you say this here, NARIC Spotlight, NARIC Spotlight.wordpress.com. Okay, so a traumatic brain injury, TBI, is caused by an external force such as blow or jolt to the head or penetrate injury that disrupts the normal function of the brain. The Centers for Disease Control and Prevention estimate that about 1.7 million people sustain a TBI annually. These injuries can range from mild TBI like a concussion to severe brain injury can also be acquired like a stroke or seizure or lack of oxygen to the brain. Brain injuries can have lasting impact on memory, cognition, behavior, and physical functioning. The annual Brain Injury Awareness Month campaign organized by the Brain Injury Association of America is aimed at increasing the public's knowledge about brain injury, current research in brain injury treatment and recovery, and resources for campaign is to change your mind about brain injury, to stigmatize it through outreach within and outside the brain injury community, empower survivors and caregivers, and promote the many types of support that are available to those living with brain injury. So they gather a few resources from NIDILRR funded projects and other organizations which they hope would change some minds about brain injury. So I wanted to give you a little brief brief detailed description on Brain Injury Awareness Month, and also give that other side of what active people that's in that community or just supporting the community are doing to help bring awareness to Brain Injury Month, and just getting involved to keep it going for survivors and giving them what they need to recover and help them with their life. And awesome. That's it. That's why I just wanted to read that.
So yeah, I have an article.
Don't you want to read no article?
I'm gonna post it up.
I know. Well, it is gonna get posted up. This is from the Defense and Veterans Brain Injury Center. So the website is DV. V as in Victor, D as in David, V as in Victor, B as in boy, I as in ice cream, C as in cat, And again, that's coming from the Defense and Veterans Brain Injury Center. So yeah, I'm led. Mm-hmm. It says more than 13,000 service members and veterans are diagnosed with a traumatic brain injury annually. To increase and raise awareness of traumatic brain injuries, we recognize March as Brain Injury Awareness Month, BIAM, and will highlight TBI champions through our 2018 hashtag TBI Champion campaign. A traumatic brain injury affects everyone who has a relationship with the injured person, from family caregivers to medical providers. All are TBI champions. And there is a YouTube video that's here that you can watch. They have a wealth of information. Also, tomorrow is the 20th, which they're heading to Capitol Hill on March 20th to raise awareness for traumatic brain injury in the military and present our latest medical advancements. So you can follow them on their Facebook page, which is DVBIC, which is Defense and Veterans Brain Injury Center, for updates, and hashtag DVBIC on the Hill. Win at TBI. Be safe. Learn the common causes of TBI so you can take steps to prevent TBI during everyday activities, at work, while playing sports, or during a deployment. To learn more about preventing TBI, you can check out these safety tips, which there's a link you can click on, and fact sheets that address the safety measures you should take before getting on a bicycle or motorcycle, driving, and playing sports. Knowing the signs, which is concussions, also known as mild TBI, often go undetected or undiagnosed initially because the symptoms can be subtle and varied. Recognize mild TBI by learning common signs and symptoms, which there is a link. If you need to get help, if you think you or someone you know has a TBI, seek medical help as quickly as possible to improve your chances of a successful story. And they have a podcast, so you can listen to different podcasts, the different episodes. I mean, they just have so much. That's that little tad bit that I wanted to read from that website, and then I'm not going to read the other link that I have. I'm just going to post it up, so thank you.
Yes, it definitely will be posted up. We're going to provide the information for you guys. So just stay tuned, watch out, because it will be posted sometime during the week. Now I will end it off with telling the social media our info, and I'll do a lot of the portion, and Jay will do her portion, of course, and then we're going to shut the show down for the night because I'm tired. I'm sleepy. Okay, so Facebook. You can find us on Facebook, Chit Chat Chew Show, LLC. Make sure you like us on Facebook. We also have a Facebook group, Chit Chat Chew Radio Show. Mm-hmm. Make sure you send us a request to join the group, and we will happily add you. You can be a part of the community and stay in the loop of what's going on with CCCS. We also have a Instagram. Follow us on Instagram at Chit Chat Chew Show. We also have a Twitter. Make sure you follow us on Twitter at Chit_Chat_Chew. Again, at Chit_Chat_Chew. Follow us, retweet, get the word out, let it go viral, let people know about the show. We thank you so much. We also have a YouTube. Subscribe to our channel, Chit Chat Chew Show. Make sure you hit the bell for notifications so you will be notified or aware that we have uploaded some new content. Also, share our channel, and comment. Like and comment. We would love the feedback, positive or negative. It doesn't matter. Anyway, it's all good. It's all love, whatever. We also have a Vimeo at Chit Chat Chew Show. Make sure you follow us on Vimeo. And I wanted to add that with YouTube, we have all our stuff uploaded up there. So make sure you check it out from past to recent. Vimeo, most of it still. Just support us anyway. Make sure you check out our Vimeo. We also have a SoundCloud at Chit Chat Chew Show. Follow us on there. Again, just like YouTube, everything is uploaded. Make sure you check it out, past and present. We thank you so much. And I will let Jade take it away with the website. Be authentic, Lotus Monk, and anything else that she usually does.
Okay, so we do have for our LGBTQ, and our allies, we have a Facebook Lotus Monk. You can go to our Facebook Lotus Monk at Lotus Monk Biz for our Facebook. We also have a Facebook Be Authentic page, which is just the letter B and then authentic, AUTHENTIC. We have that Facebook page. Do we have a Be Authentic Instagram?
Yes, we do.
Okay. So, which one is this? Okay, so we have a Twitter, which is a Lotus Monk. It's at Lotus Project. That is our Twitter Lotus Monk page. Okay. We have a Be Authentic Instagram page.
Really? That's how you feel about it.
Be
Authentic.
Okay, try that again. All right, so it's called, our Instagram Be Authentic page is B, just the letter B, and then authentic, AUTHENTIC _products with a S at the end, plural products. We have that.
Tell the website.
Let me see. Website. Thank you. We have a website, www.chitchatchewshow.com. Again, www.chitchatchewshow.com. So that's CHITCHATCHEWSHOW.com. Past, present, guest. We have a guest sign up. We have a donation. No donation too big or too small. All is appreciated and accepted because we use it towards our business. This is a legit business. This is just not one of those hobbies. We don't have time for hobbies, honey. We got to make money. Mm-hmm. And we have to do what we love, and make money. Let's just be honest. So all of our money is, hey, we're doing it right. Trust me. So we have that donation button. We have a sponsorship button for all different packages from, reasonable to, a little more upscale. So if you're interested in being featured on for our business, we have those packages as well. Let me see, what else do we have there? We have, I believe, our soaps on there. Yeah. We have our soaps on the website. Okay, our swirl soaps on the website. More to come as far as as far as other accessories and things that we're working on, but there are soaps that's up there. Has the prices for them, the small size and for the larger size. So definitely check us out with that. Hope we really would appreciate if you purchase the soaps. They're all natural, vegan based on natural ingredients for your skin. It's cool for the sensitive skin as well. let me see what else is going on. So if you would like, if your business, whether you're working solo or you're working with someone, or you're working with a lot of someone, so to speak, or if you're working for a corporation and you would like for your corporation to be featured on our show, be a guest, definitely email us. Our business email is chitchatchew_show@yahoo.com. Again, that's chitchatchew_show@yahoo.com. So if you're interested, definitely hit us up. Please, you have to be serious about doing this, okay? Because time is taken out to promote you guys on our end, and we just, respect goes across the board. What you would want from us, that's what we want back from you. We take our business very serious. So when you say that you want to be on the show, just let us know. Like, if there's something that happens to come up, please just be respectful and give us enough time so that, we can handle our business on our end as well. So I just wanted to put that out there, the seriousness of Chit Chat Chew show, our business. I'll let Uno, let you guys know about the artists.
Okay, so the artists, if you're a rapper, singer, spoken word artist, but this is more focused towards y'all, which is the singers and rappers, perform artists, whatever you want to call it. Send your music to chitchatchew_show@yahoo.com. We're looking for specifics with the songs you send. It has to be dope. We have to feel it. It's got to be great energy, man. Like, we want the music that you send match the frequency of the show, okay? The criteria. It could be creative. It could be lyrical. It could be conscious. It could be real. It could be truthful. It could be thought-provoking. It could be, whatever it may be. Whatever it is any of those, or it has all the elements, that's fine too. We're just looking for something that's different. Something we can feel that no other radio station is playing. Because we got all these platforms for your typical kind of music that people want to play. Because that's what's trendy right now. We're not trying to play that. We're not at all. Actually, no, we're not. We want to hear something different. So if that's you, please send your music to the provided email that I just said. Spoken word artists, I don't really have to worry about you guys too much, because usually when I hear spoken word artists, they're always saying something anyway. They're saying something that's worth hearing. So if you're a spoken word artist that has actual tracks, we would love to hear it on our show. Please send it to the email that I just said. Thank you so much, people. That is all I got to say. I want you guys to know that you have to take care of yourself. Self-care is first. Self-love, self-respect. And with that being said, good night. Is there anything else you want to say before I hit this button?
I just want to say, enjoy the rest of your evening. Enjoy the rest of your week. Much love and gratitude. Peace.
Peace out.